British Airways is said to be in talks to stand down more than 30,000 staff so it can survive the impact of the pandemic. Those affected include cabin crew, engineers and head office employees. The airline says its schedule has been cut by 75% for the next 2 months. At the same time, Prime Minister Boris Johnson has come under fire for the lack of widespread coronavirus testing in the UK. Britain has seen its biggest daily jump in cases, with more than 560 new infections. The number of dead has passed 2,300.
I've said for weeks and weeks, this is the way through. This is how we will unlock the coronavirus puzzle. This is how we will defeat it in the end. And what we need to do is massively ramp up not just tests so that you can know whether you've had the disease in the past, the so-called antibody test, because that will enable you to go to work in the confidence that you can't be infected or infectious.
More now from Ollie Barrett, who joins us from London. Ollie, we'll get to the testing in a moment, but first, was the writing on the wall for British Airways?
I think it was, yes. British Airways, not unlike many other airlines around the world, with the vast majority of its fleet on the ground at the moment. So it had been in talks, it is still in talks with unions about exactly what to do with thousands of employees who at the moment really honestly have very little to be doing. Now, if BA does go ahead and suspend as many as 30,000 of its staff, then that will mean that those staff are not made redundant. Many of them will be receiving some money under the government here in the UK's job retention scheme. So the government will be effectively picking up part of their salaries because BA is not sacking those staff. British Airways has been in a reasonable financial position in the last couple of years or so compared to some of its rivals, but very difficult to see how airlines survive this very challenging period in terms of aviation and the movement of people around the world without some form of assistance from governments around the world too. British Airways going in this direction. We continue to hear from Virgin Atlantic, for example, in the UK, which insists that it needs government support. The message to Virgin Atlantic from the government thus far has been, you need to exhaust every other avenue before we consider injecting some money or some other kind of bailout.
Let's talk about those testing. So the backlash against the lack of testing is gaining pace. What can be done at this point then?
It's really hard to know exactly what the government's strategy for testing is at this point, because it has been very unclear in recent days. Press conference after press conference, interview after interview. We've heard government ministers, but also the chief medical officers and scientific advisors asked about why they are not even meeting their own targets when it comes to testing. They haven't been able to give a clear answer up to this point. Matthew Hancock, the Health Secretary, is out of a period of isolation, having suffered from COVID-19 coronavirus himself. He is back at work. We expect to hear from him at Downing Street later, and everyone will be hoping that he can provide a clear explanation for exactly what has gone wrong up to this point, but how the government now plans to ramp up testing. It won't be enough for the British people to hear again from a government minister that testing will be ramped up as quickly as possible. They will want to hear definite numbers. The government insists it can get up pretty soon to that target of 25,000 tests a day, but real questions as well about why only around 2,000 members of the National Health Service have currently been tested. There are tens of thousands of NHS staff currently at home in self-isolation. Many of them could go back to work if they could be tested and found to be negative for coronavirus, so it has a real impact on the day-to-day operations of the healthcare service here.
All right, thanks for that. Ollie Barrett speaking with us from London.